Hey everyone, and welcome to Transgender Studies on the Trans Digest. I'm Wesley, your host, he, they, and this video is going to cover the basics on every medical procedure available or unavailable for transgender people. This will cover everything from non-surgical procedures to surgical procedures, voice training, packing, binding, and more for anyone that falls under the trans umbrella. Due to the nature of some of the content in these videos, we include this disclaimer. We are not medical professionals. Please consult these topics with your doctor before attempting anything talked about in this video. There is an amazing amount of medicine and procedures that exist today that can help transgender people into a more comfortable existence. However, what's even more important to note right now is this. Medical transition is a choice, and if a transgender person does not wish to undergo certain procedures, it does not make them any less transgender. It just means they can't or simply don't want to physically change their bodies. Another preemptive note is that surgical procedures are only done on fully grown adults except for very specific cases that always includes a lot of checks and balances from doctors, therapists, and parental guardians. Even as an adult, some places in the world take massive steps to ensure the person really wants to do these procedures. With that, we can move on to some of the lesser procedures done for transitioning, starting with non-surgical and medicinal procedures. The first of these procedures includes hair waxing and laser hair removal. These options are great because they're also a normal cosmetic option for anyone. While prices can vary, most salons are able to provide full body or just certain sections of the body. Some factors to keep in mind for this option include possible extra charges due to the esthetician's experience, if your hair type is thicker or coarser, and if the salon is in an upscale area. Laser hair removal is the more expensive option, but it is also longer lasting. The higher price estimated here would be around $1,100 or more estimated for the whole body. This also includes the same possibilities for a higher price as hair waxing. Another method that is used very often is doing vocal training. Now, while technically you can vocal train without a voice coach to guide the process, it is highly and heavily recommended that you don't do it without help. Just like when someone is learning how to sing, training your voice in a lower or higher register can put strain on your voice if done improperly. It is very possible to develop vocal strain, muscle fatigue, and potential vocal damage. Thankfully, we do have some free non-sponsored suggestions here for vocal coaches you can check out. There's a wide choice range of instructors on YourLessonsNow.com, courses by Renee Yoxon at ReneeYoxon.com, the SeattleVoiceLab.com has a 6-lesson promise, and Prismatic Speech Services at PrismaticSpeech.com has lessons that may include a grant to lower funds depending on your annual income. Aside from cosmetic and vocal changes, there are a few bodily options widely available. One of these is genital tucking. This method includes moving the private parts and laying or tucking them into a more hidden position. This is another method to be careful to do correctly, as it can lead to complications later on. When done safely, it is a great way to reduce body dysmorphia and allow transgender people to wear more form-fitting clothing or more. You should always make sure you take breaks and not tuck for too long. Letting your skin dry out completely after a shower or wash is also important, as well as avoiding scenting soaps and lotions. It also shouldn't hurt, so if you feel any pain at all, make sure to talk to your doctor. If you want to see more information or the process of tucking, then check out the associated links in the description. On the other side of bodily options, there is also packing and chest binding. Packing includes using a prosthetic piece to have a bit of junk in the front of the trunk, or just having a trunk in general. The baseline form of packers includes just a simple piece to provide shape and form inside of the trousers. There are also some forms of packers called stand-to-pee or STP. These include a cup and a drain to allow you to do exactly what the name implies, stand to pee instead of sitting. Some of these can also be worn as basic packers, and some are better for just their intended purpose. There are also other forms of packers, but they are not exactly YouTube friendly to talk about, so we encourage you to do your own research into these options. On to chest binding. This comes with the same warnings as tucking. You should always take breaks, not bind or tape for more than 8 hours a day, and make sure to properly wash and wear the correct size binder. Chest binding is using tape or specifically made tank tops meant to press in larger chest fat and tissue. Using tape doesn't mean store-bought Scotch tape, however. Tape binding involves using kinetic medical tape meant to be used on the skin. It is usually done by pulling the larger chest tissue towards your sides and developing a flatter front chest. You could also use certain types of sports bras. Some are made with higher compression and are safer than a binder and sometimes even tape. They won't provide as much compression, but can serve as a step forward into binding. Full chest binding and using a binder involves the specialist tank top with a strong mesh front panel. It is classified as a piece of compression clothing, and because of this, picking the right size is very important. If If it's too big, it won't compress as well, and if it's too small, it can cause damage to your ribcage and lungs over time. They can even break the skin around the edges of the binder or cause overheating on a higher temperature day. So with those risks, you should always make sure to follow the rules of chest binding. Don't wear it longer than 8 hours a day. If you have to be in it longer, make sure to find a secluded place to take a break. When you remove it at the end of the day, take deep breaths to ensure your muscles stretch to reduce pain, and always take at least 1 to 2 days without chest binding. If you wish to exercise in a binder, using a size up is recommended, as well as halting your workout if there is any pain. If you happen to swim in a binder, then just make sure to let it dry out completely once you're done to avoid skin irritation. Following medical and binder instructions, you should be able to bind safely and freely. The next step to transitioning dips into the medicinal field. There are 2 mainline methods used today. The first for younger people is puberty blockers. These are also known as gonadotropin-releasing analog blockers. A gonadotropin-releasing agent is the signal from the brain that releases to tell the body to begin producing testosterone or estrogen. These blockers were originally created for children experiencing precocious puberty, meaning far too early puberties, as well as those suffering with endometriosis and to lessen many other medical conditions. They have also proved incredibly helpful to halt puberty in children with gender dysphoria until the child reaches the normal age of puberty. They simply tell the brain to stop producing puberty hormones that can cause distressing changes to the body and mental health. For children who go on puberty blockers, they are typically started at age 8 to 9 years old. For those worried about possible side effects and risks, puberty blockers are not typically used beyond the age of 14, except for special cases. The medical risk involved with this process mainly surfaces around bone health. Half a person's bone density is grown during childhood, and assigned male at birth people are known to be at higher risk. The good news is that some medical professionals say this can be lessened by a higher intake of calcium. Also, according to PubMed, for the adolescent who goes on to receive gender-affirming therapy, theoretically and anecdotally, reintroduction of sex toys appears to mediate skeletal gains, especially for transgender males. PubMed 2022. They also press the importance that this does provide a decrease in anxiety, depression, and suicide in transgender patients. The second medicinal type method includes the widely known process of hormone replacement therapy, or HRT. This option includes a person taking a lab-created testosterone or estrogen substance to boost the levels of the hormone that aligns with their gender identity. The dosage and process is monitored by one's doctor as the hormone is absorbed over the course of that person's life. The dose can be changed as well depending on whether or not the person is non-binary or wants a slower change to their body. The hormones were also originally developed to help cisgender people who cannot produce enough of their own hormones naturally. When you start testosterone hormone therapy, it usually begins with the skin becoming thicker, sweat and pee smell will change, acne could spike in the first year, your muscles will shift, your voice will change, your hair will lessen and reduce, you may grow a beard over time, and so much more. There's a large swath of changes, and all will be covered in a future video. When it comes to estrogen hormone therapy, the process can be almost the opposite. Your skin will become drier, you'll sweat less, you begin to have chest tissue development, you'll gain fat around your hips and thighs, muscle mass and strength will decrease, your facial muscles and fat will change into a softer look, hair thickness will decrease while your hairline might show improvement, and so much more. All of these changes and experiences will also be covered in their own video in the future. Both of these methods can also be used with non-binary people by lowering the hormone dosage to cause the changes to develop slower. It can be changed over time and fluctuate depending on what results each person is hoping to achieve. It is important in any case to talk often with your doctor about the process and changes you're seeing. One of the final big steps in transition includes different types of surgeries on the body. Many of these are classified as major surgeries, which basically means they take a longer recovery time and require more care to the incisions and stitches. The first well-known method is top surgery. This can be classified as chest masculinization or chest feminization surgery. This option has also been proven to help with gender dysphoria and mental health. With chest masculinization, there are a couple of surgical options. These include double incision mastectomy, keyhole periolar surgery, buttonhole technique surgery, and gender-affirming breast reduction. It is important to note some doctors will recommend to not get breast reduction if you intend on wanting a flatter chest with a cleaner heel in the future. It will also save you money and healing time in the long run, in my personal opinion. For chest feminization surgeries, their option is to consider breast augmentation surgery. This method has been around for a while and simply includes inserting implants to create a larger figure, though it is also nice to note that estrogen hormone therapy may also grow the tissue around that area to a small cup size as well. Another set of surgical methods for transition is called bottom surgery, and use tissue that is already there or tissue from another part of the body transplanted to change the lower half into the desired set. There's also the lesser-known surgery, metoidioplasty. This is similar to the others, but is a little less invasive due to not using as much transplanted tissue. All three of these bottom surgeries have a lot of important steps before and after surgery, so make sure to talk to your doctor and listen carefully to their instructions. We'll be doing a deeper dive on each of these another day as well. Other surgeries that border on the cosmetic side include vocal and facial surgeries. Feminization vocal surgeries do have wider options and usually start with a procedure called a stroboscopy to examine the vocal cords and determine what to do next. On a quick side note, a cool fact I came across exploring this is that the sound hertz line to differentiate masculine to feminine voice patterns lies at 165 hertz. Of course, there are other factors that play in this, but this is the rough middle resonance from lower voices to higher voices. The first procedure for feminine vocal surgery tends to be the Wendler glottoplasty procedure. This is a minimally invasive surgery that creates scar tissue to retract the vocal cords and cause a higher pitch. This is often followed up or done alongside the lava technique, which is a laser-assisted voice adjustment that uses a guided laser to help shorten up the vocal cords even further if necessary. Another procedure that is performed much less these days is cricothyroid approximation. This included using stitches on the vocal cords, which would stretch out the Adam's apple and cause it to need shaving to be less prominent. On the other hand, masculinization vocal surgery has one main option and a newer procedure reported in 2022. The main surgery is thyroplasty type 3. Rarely will trans-masculine individuals require vocal surgery, as usually HRT lowers the voice well enough. But while rare, this procedure may help relax the muscles in vocal cords to allow the voice to drop further. This study is actually an interesting read as well and has published chapters online. I also highly recommend giving this one a read. Moving on to facial surgeries, these involve changes to the facial structure in a couple different methods. For feminizing facial surgeries, they focus on softening the features of the face. This can include tracheal shaves and plastic surgery to reconfigure parts of the face like the brow, nose, chin, jaw, cheekbones, etc. There are also non-surgical procedures like botulinum toxin, fat grafting, liposuction, and more. On the other side, masculinization facial surgeries use the same methods just to achieve a different look, this time aiming for sharper features and creating the appearance of an Adam's apple if desired. Both sides are done in multi-operational procedures as to not put the patient into too much pain by having the face done all at once. The procedures can also just be certain parts of the face or changing the whole face depending on the goals of the patient. The after-surgery effects and care are similar to others. You should look out for bruising, swelling, some pain or discomfort, proper bandage care, and consulting regularly with your doctor. By this point, we have the pretty decent index to the start of a medical textbook, so let's go over a basic summary of what we've covered today. Transgender people have a wide swath of options that could be available to them depending on where they live. None of these procedures or options are required for transition or the validity of that person's identity. For those that choose to do these procedures have the options of hair removal, vocal training, tucking, binding, or packing. For younger transgender people working with their doctor, they can go on puberty blockers if they are fit to help. For those approved and for older adults, there is hormone replacement therapy for different levels of estrogen or testosterone. Further along in your transition, you can choose different surgeries to achieve a better body with many options for top surgeries, bottom surgeries, vocal surgeries, and facial surgeries. And that's the basics of trans medicine. Keep an eye out for videos taking a deeper dive on some of these topics in the future as we expand our library of knowledge. Thank you for watching, and we'll see you next time. Stay proud, my trans siblings, and stick with us. See ya! You can also check out our other playlists on the channel for the 101, current events, review, studies, history, interviews, and more.